Please sit down. Nova Southeastern University, the 44th Annual Commencement Exercises. The trustees of Nova Southeastern University, the President, the Board of Governors, the administration and the faculty bid you welcome to this joyous occasion. For conferral of the degrees upon those whom the university honors for learning and diligence, and upon those whom the university charges to turn scholarships into service. Will the audience please rise and join the faculty and graduates in singing the Star Spangled Banner. You'll find the words in the front of your program.
Twilight's last gleaming
Please sit down. It is my privilege and honor to introduce to you Dr. Fred Lipman, Chancellor of the Health Professions Division. Dr. Lipman.
We welcome all of you who have joined us to honor the members of the class of 2013 to these commencement exercises, the 17th annual graduation as the Health Professions Division of Nova Southeastern University. At this time, I'd like to recognize the members of our Board of Trustees who are with us today on the platform, led by the Chairman of our Board, Mr. Ronald A. Seff. And our trustee, who did a wonderful job, Dr. Sylvia Flores. From our Board of Governors, we have Dr. Rosebud Foster and Dr. Peter Keller. Please recognize them. I'd also like to take the opportunity to introduce our Executive Vice President and Chief Operating Officer, Jacqueline Trevisano, and of course, our President and Chief Executive Officer, Dr. George Hanbury. I would now like to introduce, and if they would just stand and we'll applaud them all at once, Dr. Stanley Wilson, the Associate Dean of Academic Affairs for the College of Healthcare Sciences, Dr. Harold Lawback, the Dean of the College of Medical Sciences, Dr. David Lotion, the Dean of the College of Optometry, Dr. Andres Malave, the Dean of the College of Pharmacy, Dr. Robert Yuchin, the Dean of Dental Medicine, and Dr. Anthony J. Silvani, the Dean of the College of Osteopathic Medicine. Thank you. You may be seated. Also assisting us today for the hearing impaired is Ms. Lisa Hendrickson and Ms. Kathleen Stevenson, who are from Nationwide Interpreter Resource. Thank you. A university becomes great, not because of buildings or athletic accomplishments, although we're very proud of all, but because it develops an outstanding student body through the guidance of its faculty. So sitting behind me on the stage today are the distinguished members of our faculty and the administrators. Would they please rise and let's give them a round of applause. Thank you. You now may be seated. Thank you. The Health Professions Division of Nova Southeastern University is a constantly growing and expanding institution featuring the finest of healthcare education. We are proud of our growth, but even more proud of our accomplishments. I welcome the members of the graduating class of 2013 and you, their relatives, friends, and significant others to this very special occasion. Having more than a passing acquaintance with your faculties and curriculums, I know that you were given as much training as it is possible. I hope you have had an opportunity to absorb the zeal and personal interest of your faculties, and as they have shown a positive role that you should seek to emulate. My hope is that the faculty and administration and all the people you have come in contact with here at the Health Professions Division of NSU have given you the desire for honesty, integrity, and dedication, the traits which will give you, and as you develop in your careers, a good name. As you create your own good name, you will be helping to spread the good name and quality of this institution which has nurtured you, the Health Professions Division of Nova Southeastern University. One cannot succeed without the other. We have been honored to have you as our students and really as members of our family. We are now honored to have you shortly as alumni. Congratulations. May good health and success be your rewards, and especially may every one of you achieve a good name. And now, to open these commencement exercises, I am privileged and honored to introduce the president of Nova Southeastern University, Dr. George Henry.
Thank you, Dr. Lipman. It is my distinct pleasure as Nova Southeastern University's president to welcome all of the family members, the friends, the loved ones of our graduates, to publicly witness and to celebrate through this ceremony your hard work and academic success. I would like to welcome the audience that is viewing this commencement via streaming video as well. At last week's commencement, we streamed over 21 countries. 21 countries. Today we have about 10,000 people in the audience, and of the 7,500 degrees we will award during this academic season of the 7 commencements, almost 70,000 people will witness our graduates, not only in this arena, but worldwide. You are being publicly witnessed for your hard work and for your dedication to your academic dreams and goals. Now, obviously, today is about you, the graduates. But I do want to take a moment to commend the faculty. Just as they have previously been recognized by Dr. Lipman, they are the ones who have inspired and taught you to be prepared to really meet the future with great hope and anticipation for success. Many of you probably have a favorite professor or two, or maybe 3 or 4, but it's the collective shared knowledge that you have amassed during your years here at NSU that those professors have guided you forward. So please join me once again in recognizing the distinguished faculty with us here today. As you've heard on many occasions, and I know all of you have been through at least one undergraduate commencement, and I'm sure you've been told that it's not only an ending but a beginning. Commencement, I hope you will think fondly of and remember it as an opportunity that you've established relationships that you'll carry through for the rest of your lives. The faculty, your friends, your peers, your colleagues, your staff members, and your family who've been your cheerleaders all these years and inspired you for greatness. At this time, I would like to recognize those family members, and I'd like for our graduates to recognize them. If the family members and loved ones who have supported these graduates over these years, please stand, and graduates, please recognize those individuals in the audience. As this 2012-2013 school year comes to a close, I believe we can take this moment of commencement to reflect upon your time here at NSU, while keeping in mind that, like many areas of life, as I said previously, it's not only an ending but a beginning. You're ending your time as a student here at NSU, but embarking on a new beginning. Perhaps some of you will go on to postgraduate studies or residencies, or maybe join the military, or go right directly into the workforce. But no matter what road you take, I hope that your time here at NSU has taught you the value of lifelong learning. Many of today's professions that some of you are going into were not even thought of or considered when you first began your educational journey. We feel you've got a foundation to be competitive, but it's only through lifelong learning and your ability to adapt will you really be able to face even future professions that are not yet thought of. You're now finished with your studies at NSU, but hopefully you are not done with NSU. This commencement ceremony is the third in which I have had the opportunity to speak doing the commencement exercises of the 7 that I mentioned previously. Today, there's more than 700 of you out of 7,500 who will graduate from Nova Southeastern University this academic season. Of the 28,000 students, you have been recognized and will continue to be throughout the year as an NSU graduate. And you stand on the shoulders of individuals who have established a reputation of excellence and quality before you. All of them have celebrated hard work to achieve their academic goals. You and the other 7,500 graduates this academic year are from all over the world and from right around the corner. We've got graduates from New York to California, New Jersey, from Texas, and as far away as Angola, Brazil, Colombia, Egypt, Jamaica, Vietnam, Russia, Ghana, India, Italy, Spain, and right here in Davie, Florida. Our graduates also include active military deployed in Europe and in the Pacific in countries. And just this Friday, I witnessed the commissioning ceremony of second lieutenants and captains in the armed forces of our graduates. In fact, they range in countries from Angola to Zambia. NSU students hail from 77 countries and 48 states around the world. You keep our campuses, not only on the main campus, but our student education centers awash with activity and vibrancy while you were here. You indeed will be missed. You've studied everything from dental medicine, optometry, osteopathic medicine, pharmacy, medical sciences, nursing, and healthcare sciences. Of course, many of you came to NSU straight from undergraduate institutions and from Nova Southeastern University's undergraduate program. Others took a year off or more to travel before you started your graduate and professional programs, while you gained work experience. And still others transferred from other colleges, while others may have waited later in life to fulfill their educational dreams. To give you some idea of the diversity of those 28,000 students of Nova Southeastern University, this year's oldest graduate, speaking of lifelong learning, our oldest graduate this year is 81 years young. Now, regardless of your age, now those of you in the audience that aren't quite 81, time's still left for you too. Regardless of your age, I am sure that you made new friends and you downed more than your share of the FDA recommended allowance of Red Bull. I do hear from some of you that it gave you wings. and made memories that you will, not the Red Bull, but you've made memories of friends that you'll treasure throughout your life. You all stand out in your own unique ways to make up this incomparable class of graduates, the NSU class of 2013. Congratulations, class. And why I say this is incomparable, let me give you a few facts just about your own 700 plus graduates of the Health Professions Division. Obviously, you've been here for several years now, and you no doubt realize that we have Vision 2020 and core values. And one of those core values is community. And I think no other class has demonstrated community more than this class. NSU is proud to be one of only 37 universities in the nation out of more than 4,000 that have the dual classification of high research and community engaged. And it's because of you and those other 28,000 students that we have. In fact, in this year, we have been named the President's Higher Education Community Service Honor Roll. It's the highest honor that can be bestowed on any university, and its commitment to giving back to community and civic engagement. NSU students have logged more than 10,000 hours of service to individuals as well as through clubs and organizations. For instance, we've done every sort of engagement from Special Olympics to cancer and childbirth defects, family and child law clinics, to medical, dental, optometric, physical therapy, and psychological care, to more than 250,000 patient visits, and just in South Florida alone. The College of Dental Medicine and the College of Optometry have collaborated with Kids in Distress to provide foster children with much needed dental and eye care services. And in one day, students and faculty provided more than $200,000 of free dental service to approximately 300 children doing Give Kids a Smile Day. And the entire Health Professions Division sponsors a day for children in the health fair, collaborating through every discipline of the health professions with a large number of county-wide agencies to provide an array of services for children from birth to 15 years of age. This event alone draws more than 10,000 people a year on our campus, and you have been actively involved. You now join more than 152,000 alumni around the world, who you will find when you go in your own practice, that you're going to have a lot of sharp friends out there. As an alumnus, you are entering good company. And I know you continue to make us proud, just as you are today, and your predecessors before you. You are indeed the embodiment of NSU's spirit, and together we are all one NSU. By focusing on your goals, your dreams with enthusiasm, and with the progressive realization of that worthy goal, the degree you are awarded today will be even more valuable in the future, as the reputations of this university is built on excellence, which you will demonstrate, and those accomplishments that I'm sure all of you will see in the coming years. I mentioned community as one of our core values, and there's one that I would like to leave with you that I hope you'll continue to live and think of for the rest of your lives: integrity. I challenge you to live up to the admonitions of Shakespeare and his words to Polonius that he gave to Laertes. This above all, to thine own self be true. and it must follow as the night the day. Thou canst not be false to any man. You see, integrity is like a mirror. Once it's shattered, if difficult, if not impossible, to restore or repair. I'm not going to sugarcoat for you life for you. It's not going to be easy, even with the degree you will receive today, because you'll be tested. You'll be tested on that round of integrity, and it'll be your decision of how well you choose your life, regardless of how hard you may find life to become. Those of you that will lead an honest and ethical life through integrity, those are the ones that, as you perceive that goal and pursue that goal, will be the ones that are successful. So, I end my comments to our graduates. Keep your aim above your reach. Be bold and persistent as you have been in achieving those aims, but most of all, maintain your integrity. It indeed is your most precious and valuable asset. Thank you all, and congratulations on this year's work. It's now my pleasure to introduce Dr. Ursula Bauer, who is to receive the honorary degree of Doctor of Humane Letters, honoris causa. Assisting in the conferral of the honorary degree will be Chairman of the Board, Ron Asif, along with Dr. Sylvia Flores and Dr. Fred Lipman. If you would please approach the podium, Dr. Flores, Dr. Lipman, and Dr. Bauer, and Mr. Asif. Ursula Bauer, in recognition of your accomplishments in the field of public health and your service to the people of the United States of America, we are pleased to honor you today. In 2010, you became the director of the National Center for Chronic Disease Prevention and Health Promotion, which is a part of the U.S. Center for Disease Control and Prevention. In your capacity as a director, you have set strategic directions for the center's winnable battles of tobacco use prevention, improved nutrition and physical activity, and teen pregnancy prevention, as well as key priorities relating to the leading causes of death among Americans. At the center, you oversee an annual budget of more than $1 billion and a staff of 1,300 people dedicated to preventing chronic diseases and promoting health across the lifespan, and with attention to the primary chronic disease risk factors. You received your PhD in epidemiology from Yale University, a Master's of Public Health and Family Health from Columbia University, as well as a master's degree in political science from Rutgers, the state university. Prior to becoming director, you were the director of the Division of Chronic Disease and Injury Prevention in New York State Department of Health, beginning in 2008, where you provided leadership, vision, and directions to the state's chronic disease programs and efforts to integrate prevention activities into a focused set of strategies designed to reduce the burden of chronic disease and healthcare costs and improve health to New Yorkers. You joined the New York Health Department in 2001 as director of its tobacco control program. And in that role, you transformed the program into a focused, effective exemplar of tobacco control strategy and practice. Prior to your service in New York, you worked as a chronic disease epidemiologist with the Florida Department of Health and as a CDC Epidemic Intelligence Service Officer with the Louisiana Office of Public Health. You conducted public health surveillance, led evaluations and research programs, and designed and implemented systems and studies to monitor and demonstrate the impact of public health interventions. You were also an associate and assistant professor at the University of South Florida and Florida State University. One of your sentinel publications was an article published in August of 2000 of the Journal of American Medical Association, JAMA, that documented a 40% reduction in smoking among Florida middle school students and an 18% drop among the state's high school students in a 2-year program following implementation of the Florida Pilot Program on Tobacco Control. Ursula Bauer, you are committed to improving the lives of Americans through your public health service. Therefore, in acknowledgement of your dedication to public service, the trustees of Nova Southeastern University are proud to award you the honorary degree of Doctor of Humane Letters with all of its rights and privileges. Sunday, May 19th, 2013. It's an honor now for me to request Dr. Bauer to give the commencement address. Dr. Bauer.
Good afternoon. Thank you for the honor of this honorary degree. It's an honor to stand before the people who will shape the future of America and American health care. It's a privilege to have 15 minutes of your time to impart to you a call to action that I hope each of you will take to your heart as you lead your life, practice your profession, and work to improve health and quality of life for all the people of this great nation and around the world. The opportunity before any graduating class seems boundless, daunting, and potentially transformative. But for this class of healthcare and allied professionals equipped with the skills you have honed here at Nova Southeastern University and entering a changing healthcare landscape in 2013, the opportunities before you truly are transformative and the challenges especially critical. Like so many commencement speakers, I'll begin my remarks with a quotation, both to frame what I have to say to you and also to help you frame the way you lead your lives and achieve your goals. In a commencement address of his own, the writer David Foster Wallace said, "The really important kind of freedom involves attention and awareness and discipline, and being able truly to care about other people and to sacrifice for them over and over in myriad, petty, unsexy ways every day. That is real freedom. That's being educated and understanding how to think. The alternative is unconsciousness, the default setting, the rat race, the constant gnawing sense of having had and lost some infinite thing." Whether you work for yourself in a private optometry practice in the South Bronx, for the State Health Department in South Carolina, as a pharmacist in a chain drugstore in southeastern Kentucky, as a doctor of osteopathic medicine in a community health center in South Central Los Angeles, as a dentist for a tribal government in South Dakota, or a physical therapist to affluent Americans in state-of-the-art facilities in South Florida, your greatest contribution to your fellow citizens and the most rewarding thing that you do for yourselves, that infinite thing, will be the advocacy you deploy and the action you take, not as physicians and epidemiologists and dentists and optometrists and pharmacists and therapists, but as members of your community working to make this world a better place. Being educated and understanding how to think are critical assets to deploy in your professions and your lives. Assets that you gained here at NSU and from your parents and families and friends and from your experiences to date. Avoiding the rat race and being conscious, grasping for that infinite thing that gives meaning to our lives, will be the lasting legacy of your education here at NSU and what allows you to grow and thrive in your careers and your lives. Some cold facts about what you're up against as you embark on your careers in healthcare in America today. We're the wealthiest country in the world, and we spend more on healthcare by far than any other country. And yet our life expectancy is among the lowest, and our infant mortality is among the highest of all the high-income countries. And we're the fattest nation in the world. While smoking continues to kill 440,000 Americans every year, we continue to churn out billions of cigarettes every year. We don't produce enough fruits and vegetables to allow everyone to eat 5 servings a day, even as we know that eating fruits and veggies reduces the risk of cancer, heart disease, and diabetes. Healthful nutrition is critical to good health, but we brought junk food to the world market. We invented high fructose corn syrup, and we produce more sugar-laden beverages and foods than could possibly be consumed in a way consistent with good health. We cannot afford health care for all, given these kinds of cold facts. In health care, we're paying too much for too little, and we're not getting value on the dollar. In part, this is because we're not investing where it matters, in prevention, in communities, in our people, and in our children. Fully 75% of the $2.6 trillion that we spend annually on healthcare in this country is spent treating chronic diseases, the heart disease, cancer, diabetes, and strokes that you will spend the lion's share of your time dealing with. These diseases are largely preventable. In a transformed healthcare system, a system worthy of the name, you will work on preventing these diseases as well as treating and managing them. And in your lives, as community members, as educated professionals engaged with your neighbors, in order to make this healthcare system sustainable, you must also work on transforming your communities to support and reinforce health and healthful behaviors. Your actions in your careers and in your lives must help offload some of the burden on the healthcare system by more effectively preventing, treating, and managing chronic diseases, and by working in your communities, with your neighbors, and with your political leaders to create healthier environments that deliver healthier students to our schools, healthier workers to our employers and businesses, and a healthier population to the healthcare system. Right now, so many parts of our nation are designed for disease. We have a soft drink within arm's reach of every American, a fast food restaurant within 4 minutes of nearly every American home. We have roadways built for motorized transportation that are unsafe for pedestrians and bicyclists, and too often we have too little access to safe opportunities for physical activity for ourselves and our children. We have secondhand tobacco smoke still in too many of our public places and multi-unit homes. And tobacco companies still spend $22 million every single day promoting their deadly products. The gap between rich and poor is widening, and our progress toward equality has stalled. By engaging in health advocacy as well as delivering health care, you will help create, support, and sustain healthy communities across our great nation. You will put health in the people's hands and give Americans the wherewithal to take charge of their health and improve their quality of life. You will reduce their need for health care and help that system provide the highest quality care and the high quality health for all that we expect from the richest nation on earth. Here's another cold fact. Right now, 80% of our seniors, that's people aged 65 and older, are non-Hispanic white, and 54% of our youth, people under the age of 18, are non-Hispanic white. That's what Manuel Pastor calls the demographic generation gap. And in the states where the demographic generation gap is greatest, we see the lowest investments in education and the lowest investments in infrastructure, the lowest investments in our human and physical capital. As Pastor puts it, the old are not seeing themselves in the young, and thus are not investing in our country's children. But as our young people become enfranchised, and as our elders become frail and disengaged, what will matter most for our nation's priorities is that the young won't see themselves in the old. It won't be education and public transportation that we're not investing in. It will be Social Security and Medicare. My point is this: the challenge before you in your professional and personal lives will be to make gains toward achieving health for all so that we can afford to invest in all our priorities for all of our people. The challenge before you in your professional and personal lives will be to create and spread the empathy and understanding that our nation so desperately needs to navigate our changing demographics, to transform our disease care system into a health care system, and to live the ideals that inspire our nation. Caring about people and sacrificing for them is what healthcare professionals are trained to do, but in a technical way, in a way to protect ourselves from becoming exhausted and overwhelmed by the many seemingly intractable problems that so many seemingly an unending flood of people present with. I'm asking you to take that ability to think and understand, that ability truly to care about other people and to sacrifice for them outside your practice and your patient relationships, and along with the trade you learned at this great institution, to deploy your education and your compassion, your concern and your sense of justice in your community in order to transform our communities all across the country and around the world, to transform them into places that support and reinforce health instead of disease, into places that give all our people the wherewithal to take charge of their health, and into places where life, liberty, and happiness truly are achievable. You are up to this task. You are educated, you understand how to think, you have the attention and awareness and discipline to grasp that really important kind of freedom. You can reset the default, stay out of the rat race, and hold on to that infinite thing that makes us human, that gives life to our ideals, and makes our nation a better place for all our people. We are depending on you. Today, May 19th, is Malcolm X's birthday. As you reflect on your commencement, this beginning, over the course of your life, I hope you remember the significance of this date for his contribution to bringing our country to a new birth of freedom. I hope you highly resolve with a substantial measure of devotion, if not the last full measure that Malcolm gave, to deploy your education and your understanding of how to think to the richest and most rewarding task of caring and sacrificing for our people and for yourselves in order to achieve that really important kind of freedom. Thank you.
Thank you, Dr. Bauer. Let's give her another round of applause. You certainly are one of the great heroines of healthcare in this country, and we're proud to have you here.